Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a news part interlude. This audio podcast as part of a Storm and Squala, and this audio podcast as part of a Storm Robotics production. In this audio podcast, a sort of an excerpt, looking at an excerpt from some published works in around some published works from around 2015, 2016. So there is good evidence to inform or suggest that healthcare service users sort of adapt varying sort of well-being or coping sort of well-being or sort of coping strategies. Peer support at the same time, peer support at the same time could empower health patients or patients or healthcare service users with sort of well-being skills, and to the extent that knowledge and experiences could be effective for others in similar situations, so thus helping or aiding or thus aiding to deal with sort of the challenges faced in living with varying sort of with thus 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 helping deal with varying challenges that are faced and at the same time the sort of the in amongst literature healthcare service provision healthcare service provision has although not sort of evidenced evidence substantially evidence although not evidence substantially sort of healthcare service provision is required to provide to provide healthcare service users pertinent understanding in regard to wellness and well-being. And there has been a sort of a depth of a sort of a sort of depth of sort of publications and works across specialisms such as kidney care surrounding various aspects of surrounding various aspects of the conditions, from pathophysiology, laboratory medicine, pathology to physiotherapy, and amongst other amongst other specialisms. In this context, it has been important, perhaps more than ever, to ensure that barriers or hindrances to healthcare services and healthcare service users through to healthcare service users are are signposted or able or are signposted or are able to identify varying healthcare service provision modalities, healthcare service provision modalities, and thus where healthcare should not just integrate between healthcare sectors, but where healthcare service users have access to varying healthcare professionals, and divide and I'm sorry and depending on case scenarios. Whilst there have been some promising works promising works are sort of published. One of the main conclusions, or one of the main sort of findings, one of the main sort of findings in some works from around 2015 and 2016 was the investigatory team had informed there needs to be sort of collaborations and collaborations which are much needed and are much needed or required in linking to a link to explicit services in healthcare services, where young people aligned to pediatrics and young people who suffer with varying sort of chronic illnesses, chronic kidney disease, CKD, including, and this should be part of this should be part of sort of collaborative efforts should be part of a remit amongst healthcare service providers. In this case, in the case of pediatrics and young people, it is important to involve parents and guardians. Thus they are equipped with best practice in a survey of 353 people with long-standing conditions. It was reported that healthcare service provision that healthcare service it was reported that healthcare service provision is most sought from healthcare professionals in around 76%, then websites, sort of helpful websites, in around 75%, and then family or friends in around 64%. The investigators in around this in around a particular publication, publication had identified that literature surrounding sort of well-being in amongst young people with chronic kidney disease or CKD had been underreported. That draws this audio podcast to a close. This audio podcast as part of a Newspart Interlude. This audio podcast as part of a Ztorm and Squala. And this audio podcast as part of a Ztorm Robotics production.